ask you about the estrogen metabolites, because that's not an area that
Uh,
we touched upon. Just as to if you can comment on, because metabolites is obviously something that we get in the Dutch test that we don't get in serum.
right.
And so, if you can speak to the benefit of the metabolites and their
Sure.
clinical validity, maybe a little bit, and then we can wrap
Yeah, that usually is where the urine test
up.
begins for HRT. Is most
Yeah.
people historically have said, well, either they're using saliva, which I think is misguided,
Mhm.
or they're using serum, which I think is difficult, or they're using nothing. They're not using any test to gauge the dose. And so my point is, I think you can use the urine to tell yourself if you got the dose right. Okay,
Right.
that's question number one. Then the second question, which urine, as you're alluding to, can open up a window to, is what's my body doing with that estrogen? So there's phase one metabolism, where I've got three different doors the estrogen can kind of flow into. Either the 2-hydroxy,
Mhm.
which it has more friendly properties as it relates to cancers that are
Mhm.
related to estrogen, or the 4-hydroxy, which some people call it the good, the bad, and the ugly. The 4-hydroxy can damage DNA. There's potentially carcinogenic risk, like that is at play with that particular metabolite when it predominates. And then there's the 16-hydroxy estrogen. The 16-hydroxy can kind of cut in both directions in that it creates more estrogenic impact. So sometimes it's good that you make some of that if you have very low estrogen, because it's sort of it may help your bones. It may help like the estrogenic impact. Um, and then if it's but if you're favoring that strong estrogen and you have a lot of estrogen on board, it can
Mhm.
exacerbate like high estrogen symptoms, estrogen dominance, that sort of thing. So we want to evaluate, am I
Right.
pushing down this pathway or these other pathways? And one picture is a little bit more favorable, and
Mhm.
then we know that there are nutraceutical interventions that you can use, like diindolmethane, indole 3 carbinol, to help push it down what's considered that more favorable pathway. That's phase one. Then
Mhm.
phase two includes methylation. And methylation is a protective step to take the 4-hydroxyestrogen and the 2-hydroxy to an inert form that you can then get rid of. And so all we're looking at there is, what's your conversion? When you
Mhm.
make a hydroxy, are you turning a methoxyestrogen, turning it into that
Mhm.
inert end product? So me, for
Yeah.
example, I have a COMT, the enzyme that does that,
Mhm.
mine's defective. And
Mhm.
so every time I do a Dutch test,
Right.
I make the 2-hydroxy. I don't turn it very well into the 2-methoxy, which
Mhm.
means for me, I could use support in that area, magnesium, things to
Mhm.
support methylation.
Right.
Why? Well, because as a guy, those
Mhm.
4-hydroxyestrogens are also relevant as it relates to prostate cancer risk. And
Mhm.
so for both men and women, we want to evaluate, what's my estrogen level?
Mhm.
How is it being metabolized in terms of phase one, sort of good, bad, ugly? That's a little of an oversimplification, but
Right.
that's the idea. And then, am I making the safe inert end products out of these reactive intermediaries or
Mhm.
not? So those are like the three levels of questions that we get
Mhm.
to ask about estrogen, which brings value to the testing that we're doing.